Hear, hear. Hear, hear. Hear, hear. Parkinson's Podcast. Welcome to the Hear, Hear Parkinson's Podcast, where you will hear from special guests covering the world of Parkinson's with a deep dive on the World Parkinson Congress and a look at how the WPC has helped make extraordinary progress in the Parkinson's community by creating space for people with Parkinson's to have a seat at the table.
Hear, 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 hear. Another episode of the Hear, Hear podcast, the Parkinson podcast, leading us up to the next WPC, World Parkinson Congress, in Phoenix, Arizona, May next year. I am Edgar Valdmanis, one of 15 global ambassadors for the Congress, and I've been tasked with running this podcast on a bi-weekly basis, meaning every other Friday from now until the Congress opens. We will be on the air with a new episode and a new guest. I usually have Eli Pollard as my co-host, but this episode I have Roberta coming on. Very welcome in, Roberta.
Hi, Edgar. Thank you so much for having me. It's a pleasure to serve as your co-host today, especially since today's guest is a dear colleague and mentor of mine. So I'm really happy to be here.
Right. And the dear colleague and mentor is
Malú Tansey, Professor of Neurology at Indiana University School of Medicine. Thank you for having me. This is very exciting.
Good, good. You said dear colleague and mentor, Roberta. Can you say a little bit about yourself first?
Yes, of course. I am a geneticist and neuroscientist. My lab is located at Weill Cornell Medicine in New York City. And our work focuses mainly on understanding sex differences in the risk and development of Parkinson's disease, especially the role of hormones and menopause. I'm also co-founder of a nonprofit organization called Stop PD, which develops and provides complementary programs for Parkinson's disease, such as exercise and theater and voice. And then last but not least, certainly not the least, I'm a scientific ambassador for the WPC. So I'm serving as scientific ambassador today. Really, again, happy to be here.
Right, right. So how is a scientific ambassador different from my role as a general ambassador or regular or whatever?
Well, we have the task of promoting the Congress, like all the ambassadors, but mainly through our connections to the scientific community. We try to, promote it amongst scientists and doctors to make sure the attendance, as the goal of the Congress is, it's a mix between, again, scientists, doctors, and people with Parkinson's or caregivers or other professionals. So we're mainly promoting and involving people in the scientific circles. So.
Right. Do any of you have the diagnosis yourself? Any of the scientific ambassadors?
No.
No, because I think most of the other ambassadors do have it. Actually, I've been diagnosed myself with this bloody disease since October 2019.
Wow.
So I'm definitely one of those.
Yeah.
And Malú, how come that you are so involved with the Parkinson's? I sometimes ask doctors, I say, if you were just the what we call the household doctor in Norwegian, a person would come in with a common cold and you would give him a bottle of cough syrup or whatever and say, go home and take a spoonful of this every 2 hours or so, and they are fine. But you chose to work with Parkinson's, and we actually get worse and not better.
Well, I would say not always worse, right? There's a lot that people with lived experience can do to increase the quality of life, like exercise and, um, daily activities that keep you moving. I think that is an interesting and very underappreciated way to have some control over what happens to you. When I was at the first WPC in Glasgow in 2010, I was invited to give a talk on inflammation, and there wasn't a lot of inflammation and immunity work going on in the field. But I remember sitting in a very large audience and a patient asking, what can we do to help ourselves that does not involve pharmacology? And and there was a lot of silence there. And all of a sudden, they started talking about exercise. And I remember very well her saying, it was I'm trying to remember who it was, but it was someone who was working on the effects of exercise in slowing down progression and improving your balance and, mobility. And I remember this very well, where she said, 20 minutes every day, break a sweat. And so it's different for every person. But as long as you do it 20 minutes and you break a sweat, you're doing it right. So I think that's a really exciting thing, because now, 15 years later, that's a really important part of making sure that you are working on the quality of life and that you don't progress too fast. And dance and other things to improve balance, I think, are so critical, because, as you know, the falls are a problem.
Yeah.
So, yeah. And you
That,
asked
that,
why
that's no, sorry.
Nobody
No, so
can.
you asked why Parkinson's, and I said, well, my grandfather had Parkinson's. He lived in Mexico, and I don't think he was ever officially diagnosed or treated. Um, but I remember living there and visiting him often, and not understanding, why he couldn't move, why he would shuffle, why he would get really emotional, and he struggled to speak, and he had the masked face, and he had the tremor, and he had the rigidity, and he had all the cardinal motor signs, and yet, nothing, he was never treated for it. And so I think, as I became interested in the brain, I got my degree in physiology, but as I got interested in the brain, I started thinking back at that, because he was a big influence in my life when I was
Right.
a child. And I think that's part of why I'm so committed to understanding and trying to find a cure. It's in
Yeah,
my
well, if
family.
your grandfather was uh, as heavily attacked as you say, and not properly diagnosed, not properly treated, I can understand it. How about you, Roberta? You wanted to say something in between here.
Oh yeah, I was saying, like, when Malú brought up the example of the conversation at the WPC about exercise, I thought that is actually the place when I attended my first WPC, as the place where I came across the importance of exercise for Parkinson's. And I was saying, isn't that the beauty of this Congress, to really bring together people from different worlds, from different fields, to communicate and really sometimes you discover things that you were not aware of, and you just have, for me, like, just step away from the bench once in a while and really talk to somebody that experiences the disease. And so that's what happened, and that's where my ideas come from now, just talking to people that have the disease. So I think that's really
Exactly.
important.
It's very inspirational, right? Because most of the time things don't work in science, and let's face it, it's a struggle, and the motivation sometimes to stay in there, especially for our trainees, is just not there. And so I do believe that the WPC is one of those places where not only are you able to learn from other scientists, but from people with lived experience, and get the inspiration you need for when you're feeling like, why am I doing this?
Yeah,
And
that's true.
my trainees always say that's the best meeting, that it really changed the way they think about how they are going to be able to make a difference.
Yeah.
Right. I'll get back to that in a second. What is your experience then, Roberta? How many WPCs have you attended so far?
I've attended 3 so far. I've attended the one in Portland, the one in Montreal, and the one in Kyoto, and they were all amazing. All a little bit different, but same goal, but they were all really, really inspirational. So, yeah.
Yeah.
I'm looking forward to the next one for sure.
Definitely.
What makes the WPC stand out from other congresses and conferences, whether medically oriented or any topic of the day, sort of? What makes the WPC stand out?
For me, it's all about Parkinson's, and it's about Parkinson's, the disease, the living with, the challenge, the opportunity. It is an immersion. It's an immersion course that you go to, learn and get motivation and really understand the latest that has been discovered and things that will really require, replication or collaboration. It's where a lot of people go to get ideas, like Roberta said, get ideas and then reach out and collaborate. And I think we don't appreciate how important it really is for those of us that do preclinical work with animal models and cells and tissue culture, how important it is to have the people with the lived experience be our partners, right? Because they're the ones that are participating in the clinical trials or in the observational trials. And interestingly enough, whenever we have a study that we're recruiting for because we're looking at their immune system, it's actually harder to get controls than it is to get Parkinson's individuals because they're incredibly helpful and motivated. The controls.
We must be. My view is I have this bloody disease in my body. This lady over there in Indiana is looking for participants. I have nothing else to do with my day. I mean, I'm out of the job market totally. So why don't I go over and volunteer for her study? Whereas the controls are probably still working.
Yeah, some are working, some are partners, right? Care partners.
Yeah.
And for those of us that study the environmental effects, the infections, the diet, the microbiome, the closer the control is to the individual with Parkinson's, the better your understanding is going to be because they're in the same environment. So it's really critical.
Yeah. Where was I? Oh yeah. Back to this topic of exercise. You're sitting close to the Rocksteady Boxing head office, aren't you? Isn't that in Indianapolis as well?
Yes, Indianapolis. That's right. I think they're one of the things they're known for. There's a fair amount of interest, I think, everywhere. But I think Indianapolis has a really good powerhouse for neurodegeneration. One of the interesting things is, I came here to expand the Parkinson's studies more in neuroimmunology studies, but the Alzheimer's infrastructure is really strong. And I think that it's an opportunity for us to learn about the commonalities with other diseases that are much more common than Parkinson's. And in fact, there are now a few studies that are being sponsored by the Alzheimer's Association, the Michael J. Fox, and Cure PSP. There's an interesting one that we just submitted a letter of intent on sleep, right? And sleep disturbances, sleep biology. What can we learn about the role of sleep and how it changes and maybe, interesting to look at for risk and progression.
Have you been in touch with the 2 Norwegian professors that are running a study on sleep?
I have not. The only people from your part of the world that I have collaborated with are Phil Shepojans in Finland and Marina Romero in Aarhus, and
There
Andy
is also
Howden
Paris
in Dublin.
Veningston. There is also Paris
Oh,
Veningston,
Paris Bennington. Yeah.
Karolinska. Yeah, is great. Yeah. Yeah.
Paris Bennington at Karolinska, and Per Borghammer at Aarhus. Yep.
Right, right. Then I will, if you're interested, I could
Yes,
connect you with
I would
the
love to.
good, good. I'll do
Yeah.
that offline a
Okay.
bit later then, because that actually also ties in with what we've just been discussing. First, I joined the study. It's called the GRIP study.
Mm.
The G stands for glymphomatic whatnot. Yeah, I'll get the full explanation of the four letters in GRIP through to you. But what
Oh,
happened was, as I said, they had a problem getting controls, so they had 19 people in place and lacked the 20th. And then my wife actually came forward and said, "Well, I can do it." And I said, "No,
fantastic.
it's pretty stressful, you know. I've been through 5 MRs in just as many days."
A lot.
Wow. And
And
what is the purpose of the study? What are they studying? Is it sleep or?
yeah, in layman's terms, which you will have to accept then since I am one, they say that this glymphomatic whatever,
The lymphatic system, probably, right?
yes,
Lymphatics. Yeah,
exactly.
that
Yeah.
clear
Healthy
the
people that get their brain cleaned every night.
Mhm.
that's right. Hmm.
I don't, because
You
my
don't sleep?
brain clogs up with some protein or whatever, and that is sort of the what you call the hypothesis of the study, is to check whether that is correct or not. And uh, and then when my wife had been through her 5 days there, they said, "Could you actually come to one of our internal conferences for the whole community?" Because it turns out they have not only doctors involved, but also mathematicians that are
Wow.
actually have no connection with medicine at all. They have statistic people, whatever you call them then professionally, and a number of other trades that are in and take samples from their study and study on their own. And so my wife was asked to come and present how it is to be one of the lab rats actually in the study. And afterwards, lots of the participants came up to her and said, "Well, this is excellent because we never see the patient actually. We get like a reading of blood samples or a reading of a dozen other samples there, whatever it could be, and they then break up the figures and do the math and everything, but they never meet a patient."
Right. No, it's good to put, have some personal interactions. It's life-changing.
Yeah. And I think also that as one of those non-medicine people in the room, you will actually learn a lot about what is behind the numbers and the people that are behind the numbers and everything. And so I definitely hope that you will succeed, Roberta, getting enough, what did you call it? Scientific people into the rooms in Phoenix, because that is, in my mind, one of the strengths of the WPC. I spoke to Sara Riggare from Sweden the other day for one of the other episodes, and she said, "I come for the science and I stay for the community."
Yeah.
I love that.
Yeah.
That's wonderful.
Then I'm sure that Sarah will let you steal it and run with it.
I think that's a very common sentiment that you get a lot of inspiration. The first time I met someone at the Congress, who had lived experience was Rochelle Flanagan in Ireland, and she's lovely. And she's very much into the diet, the exercise, the hormones, the sex differences,
Yeah.
like
Yeah.
menopause, the things that Roberta studies.
Yeah.
And she was so inspirational. And I met a whole bunch of friends of hers, and it was just, Kathy Calhoun, for instance, Claudia, I forget her last name, incredible people. And they took us to do the dopamine dunk in Barcelona. So we got in the ocean in the morning to get our dopamine rush. It's not the same as Ireland. It's a little bit less cold, but it was still kind of a wake up call.
Back to the exercise part, are any of you gonna join the bike teams going into Phoenix?
Oh man, I'm not, but I hear they're already planning and, getting excited about it. I think it's wonderful. I always get choked up when I see the bikes roll in to the venue. I
Yeah.
remember it so well, that it's just something that it's just hard to explain, right? And it just this feeling of pride and commitment just sort of wells up inside you. So I'm really looking forward to it, but I'm not riding.
I've been considering it. It's just kind of far from New York City, but we'll figure it out.
Yeah, maybe you can go to I don't know,
Like somewhere
yeah,
halfway or something, and then bike the other halfway. I'll
that's
figure it
right.
out.
Fly
No,
into
but
El Paso and then go.
I think the main ride is from Seattle down to Phoenix.
Yes, that's what I heard. Yeah.
And then there are now like 6, 7, 8 other starting points. There are people starting from Chicago. There are
Wow.
people starting from further down south, sort of going
Amazing.
across more than going downwards on the map.
Yeah.
As I say, I think it's 6 or 7 starting points, and we still got 15 months to go before we're
Amazing.
there. But I think
Yeah.
that's an amazing way of
Yeah.
getting to the Congress.
Maybe there's still time to train.
Oh, there is plenty. As I say, it's like roughly 15, 16 months. So you have plenty of time to train and get on your bike and
I will
pedal
consider it.
No, they
I'll
also
pick you
do
up, Malú. Malú, I'll pick you up.
Hey,
Come up there
that's
and
good.
we'll go.
Indianapolis, we'll meet in the Fork, right? We'll meet in Nashville.
Yeah.
So what would be the slogan, Malú, if they were to ride? Because, last time it was bike to Barcelona, BB, and now it's pedal to Phoenix.
Pedal to Phoenix. That's right. I
So
like
it has
that.
to be something with in from Indianapolis.
Indianapolis. Let's see. How about
Get inspirational. No.
yeah, inspired to Phoenix. Inspiration.
Yeah.
What is what the Fox Foundation likes to say? We are here until Parkinson's is not. So I like that.
Yeah, I love that slogan. Here until Parkinson's isn't.
That's
It's
right. We're putting ourselves out of business. I like
yes.
that.
It should be the best news, right? Yeah.
Mm-hmm.
Yeah.
Absolutely.
So what would be? Let's say we meet each other in a cafe somewhere, Indianapolis, and you say, "Yeah, the WPC is coming up," and I say, "Yeah, so why should I attend?"
Yeah, I would say you should attend because every Congress we learn something new that we can actually apply to ourselves, whether we have lived experience or we have a loved family member with the experience, or we do research. And it's really eye-opening and inspirational when you're doing the work of biomedical research, which is hard. And as you know, science is under attack at this moment. all over the world. And it's so inspirational to attend and sort of recharge your batteries. That's really what it does for me. It recharges my batteries, and it reminds me why we are in this field. Because we all want to make a difference. When you get up in the morning, you want to go make a difference in something that you do that day. And when it's difficult to do that because you're not motivated and there are many other things that you need to take care of or be concerned about, you just need to think back at the experiences and the friendships that you've made at this Congress. And I promise you that it gets you through. It gets you through the commitment to understand, how can we mitigate the effects and, the loss of quality of life from Parkinson's.
Right. And Roberta.
Malú, I have a question actually, Edgar. I don't know if Malú is allowed to tell us
Absolutely.
about it. Because she's also in the organizing committee of the Congress. Are you allowed to tell us what's coming up? Like, can you give us some
Sure.
snippet or what it's been decided?
No, we have been working to make sure that we have a couple of different things. We want something for everyone. Whether you are a young scientist, budding scientist, established scientist, clinician, or you are a person with lived experience or taking care of one, or just simply want to learn about, your risk and your family history and things like that. So I would say that when I think about the program, it's divided, as you know, in two basic ways: the scientific and the clinical, right? And then there's the care partners and the sort of the community aspect of it. And when we reviewed the program, it's really taking shape in terms of diversity of topic, and the ability to have people who will speak and will be understood by a lay audience, right? And as you know, they have the thermometers for, high scientific content, low scientific content. I think that's really important because we all want to stretch, right? And so I may not understand everything that is said, but I'll understand something, and I will take something away that I can then go ask my doctor about, right? And say, hey, I heard this, what about it? And the doctor goes, what about it? And so then he has to go learn, or she has to go learn. So it's a really interesting program, I think. We have, genetics, we have immunity, inflammation, we have, animal models, sex differences, clinical, aspects, like how would we devise a clinical trial if we were going to prevent the progression. So it's a lot of really interesting and new topics that are, I think, going to resonate very well with people. And of course, the biggest, news right now for the field is the advent of the synuclein activity or synuclein aggregating assay, right? So the idea that you can look in the cerebrospinal fluid and find small catalysts that can explain the potential that the person has to nucleate and to propagate synuclein pathology, right? So that's starting to be a biomarker that can be used along with other things like the scans and the family history and, things that may indicate that you're at risk. And so the SAA, synuclein aggregating assay, is a really huge advance for the field because it will give us, what we call a biomarker, and I think that's going to be really important. If you're trying to target synuclein and someone doesn't have problems with synuclein, that they're not going to respond to your therapy.
Correct.
Right. So you have to use it to enroll the right kind of patient for the right kind of trial.
Yeah.
Right. That was a longish explanation, Roberta. Can you do it?
Say that it's going to be a fantastic program. Yes. And it's
Good.
very balanced in terms of sex, gender, disability, stage of training. So one of the things we like to do is not see the usual suspects on stage every time, right? The same people all the time. And, people get tired of our faces. And so we're trying to pick new faces and younger faces and the next generation that's going to, put us all out of business.
I am out of business already, so they can't help me there. One of the last questions back to you, Roberta. Again, we meet somewhere downtown, and I say, so why should I go to Phoenix? I mean, I'm not a scientific person at all. My background is in sales and marketing, and I live in Norway, so it's quite a stretch. It's not overly costly, but yeah, it does cost a bit to fly to Phoenix, etc. Why should I go?
Well, as Malú said, I don't want to reiterate the same things, but as she said, it's a unique experience that you cannot have in any other conference on Parkinson's disease. And if I can tell you my personal experience, it did change my life and overall in my career at a point where when I attended my first WPC, I was considering quitting academia. I was
Why were you
considering
considering quitting?
it's just so challenging and so hard. Sometimes the downtime, like the times where you're like really, really low are so long. It's such a long stretch before you can go back up and finding motivation that it was like a long stretch of bad times. So I was really considering it. And that's when I went to the WPC and found motivation and inspiration. That's when I started my nonprofit organization for Parkinson's, because I said, if I'm quitting academia, I want to stay and I want to help people no matter what. And that's when I started that. And I dragged my husband into it. He's amazing. He's the one that comes up with all the programs and all the ideas. It's fantastic. But anyway, going back to that, it changed my life. And then by talking with the people that have Parkinson's, I found my motivation again and went back to the bench and got my new ideas, my ideas of understanding sex differences, which are really important. Because if we don't know that, how can we even tailor therapies? So it goes back all, I was leaving the bench and I went back to the bench. And that's all thanks to the WPC. So.
And this was which WPC?
That was the one in Portland.
Right.
Yeah. Yes. So, yeah, it was amazing. Yeah.
All right. So I understand now that I better go grab my conference ticket and book air tickets as well, so that we can meet each other in Phoenix.
Yeah.
At the end of May 2026. We've been to a number of very interesting topics. Thank you both for participating. We got one exit question, as we call it, before I let you go. And it says that if you're in an elevator and it all of a sudden stops between two floors and you're stuck, who do you want to be stuck with?
Yeah, it's an excellent question.
Thank you.
I really enjoy that hypothetical. And I guess, but since we're talking about motivation and inspiration, the one person that I would love to have a conversation with, who I've had conversations with,
This is, I forgot to say, it's totally free in space and time.
Yeah, absolutely. So he's still alive. It would actually be Michael J. Fox, because I want to know how he, how far he has to dig to get his commitment to something that has changed so many lives. And I mean, not just for the people with Parkinson's, but for people that are doing investigations. And I have to tell you that when I was, in science, you usually have to, you train as a postdoc after you get your PhD. And most of the time, whatever you're doing as a postdoc, you're going to go take and you're going to set up your little store and your lab, and that's what you're going to work on. But I didn't do that. And so I actually worked on a topic that was not that exciting in 2002, which was inflammation. And the NIH was not interested, right? I could not get a grant. And so you're there, you run out of startup, and you're thinking, okay, how am I going to survive, right? Because it is hard. It is very difficult. And the Michael J. Fox just happened to have an RFA, request for applications, on the role of inflammation, right? And I was like, wow, that's perfect for us. And so what I would ask Michael J. Fox is, how is it that despite knowing that whatever research he's funding isn't going to directly benefit him, but people that come after him, how, what does he say to himself in the morning every time he gets up to keep that motivation and commitment going, right? I've
Good.
read his books. They're so inspirational, right? Lucky Man, and basically feels privileged to be able to help. So I would just want to know, what are some of the things that he does to keep himself motivated? And I would want to use that because in this time, very difficult time for academia and science in general, I have a lot of mentees that aren't really, having a great time because they're thinking they should probably quit because it's such a hard, field,
Yeah,
and
yeah.
there's no support. And so I would want to know how he does it so that I can, borrow a page from his playbook.
Good, good. Roberta, how about you? Who would you want to be stuck with?
I'm thinking I was thinking about, again, the type of people that attend the conference, and I
It
feel
doesn't
like
have to be at the conference. It can
I
be
know, I know, I know, I know. I'll
just
get
so that you're
there.
not limiting yourself to a very
Yeah, I'm
specific.
not. I'm just thinking whom should I, I would like to talk to and engage so that it could be beneficial to everybody. And I think one party that is missing, or it's has a low attendance, is pharma. And I would like to really talk to all these big pharma executive and know what are they doing to catching up, to level the playing field and having more, fair and rigorous clinical trials, so that actually whatever they test in the clinical trials can come to fruition and not fail often more than, that would be my question. Come to the Congress, talk to everybody, and please, again, as I said, I want to know what is the difference between men and women, because I think enrolling more women and making it more fair and more rigorous will really benefit both men and women. So I really would like to know what they're doing about it. That's my answer.
An excellent question. We're going to do what we can to bring more pharma there. And I think the partnership with pharma and the government and academia is so important, especially now, because I was telling my trainees, this is not a time for you to say, oh, I'm just going to leave academia, because it's not just academia that's struggling.
Mhm.
It's a war on science, really,
Yeah.
and facts and data driven research. And if you go to pharma, you can experience the same thing, right? Your drug is never going to get approved because the FDA, isn't qualified to make those calls. If you go to the government, do you know what those problems are?
Yeah.
You can't even send an email right now, right? And so I think we need to think about this as a global challenge of everybody needs to circle the wagons and join hands and figure out how we can explain to people the importance of what we do, and how important it is to continue that support so that we can have cures and answers for our children and grandchildren.
Good, good. Thank you both for being here this afternoon. Thanks for being my co-host, Roberta.
Of
Thank
course.
you, Malú, for
Of course.
valuable input. And I look forward to seeing you both in real life in Phoenix.
That
Yes.
sounds wonderful. I want
Bye.
to also thank you for the time that you have taken to interview me and to ask all these fun questions. I think it's an important partnership, and so I thank you both for your time.
Thank you.
Thank you. Bye.
Bye
Bye.
bye.
Thank you for joining the Hear Here Parkinson's podcast. If you would like to experience the next World Parkinson Congress for yourself, to feel and see the change in real time, save the date to join us from May 24th to the 27th, 2026 in Phoenix, Arizona. Learn more at WPC2026.org. This podcast series is made possible with support from Blue Rock Therapeutics.